What if I told you that right now, 1 in 7 adults has chronic kidney disease, but 90% of them don't even know it? Your kidneys could be failing silently, and by the time you notice something's wrong, it might be too late. Today, I'm revealing 15 visible warning signs your body is desperately trying to show you, signs that most people completely ignore until they are sitting in a dialysis chair. And here's the shocking part. Sign number 7 is something you see every single morning but probably think is completely normal. Stay until the end because sign number 15 is the one that sends most people to the emergency room, but it could have been prevented months earlier. Before we dive in, let me share something that might save your life or the life of someone you love. Your kidneys are like the silent heroes of your body, 2 bean-shaped organs, each about the size of your fist, filtering 200 liters of blood every single day. That's enough to fill a bathtub twice. They're removing waste, balancing fluids, controlling blood pressure, and even producing hormones. But here's the terrifying truth. Kidney disease is called the silent killer because you can lose up to 75% of your kidney function before experiencing any symptoms at all. I'll never forget when my colleague Sarah, a healthy 35-year-old marathon runner, discovered she had stage 3 kidney disease during a routine checkup. She thought her fatigue was from training too hard. The puffy eyes? Lack of sleep. The signs were all there, but like most of us, she didn't connect the dots. Today, we're going to connect those dots together. And please, share this video with someone you care about. This information could literally be life-saving. Sign number 1. Changes in urination. Let's start with the most obvious but often overlooked sign, changes in your bathroom habits. Your kidneys produce urine, so when they're struggling, this is often where the first red flags appear. Are you getting up multiple times at night to pee? We call this nocturia. And while one bathroom trip might be normal, especially as we age, if you're making 3, 4, or even 5 trips, your kidneys might be losing their ability to concentrate urine properly. But it's not just frequency, pay attention to foamy or bubbly urine that looks like beer foam or dishwashing soap. This could mean protein is leaking through damaged kidney filters. Dark amber or tea-colored urine when you're well-hydrated. Difficulty urinating or feeling like you can never fully empty your bladder. Burning sensation without a UTI. Think of your kidneys like coffee filters. When the filter tears, coffee grounds get through. Similarly, when kidney filters are damaged, things that should stay in your blood, like protein, end up in your urine. Sign number 2, swelling, edema. Now, let's talk about something you can literally see and feel, swelling, medically known as edema. When your kidneys can't remove extra fluid and sodium from your body, where do you think it goes? It accumulates in your tissues. Demonstration: press your finger into your ankle or shin for 5 seconds. When you remove it, does it leave an indent that takes several seconds to bounce back? That's called pitting edema, and it's a classic kidney warning sign. The swelling typically starts in your feet and ankles. Your shoes might feel tight by evening. Hands, rings become difficult to remove. Face, especially puffy eyes in the morning that don't improve after being awake. Abdomen, clothes feeling tighter without weight gain. Here's what most people don't realize. This isn't just water weight from eating too much salt last night. When kidneys fail to filter properly, they can't maintain the delicate balance of sodium and water in your body. The result? Fluid builds up where it shouldn't be. Sign number 3, persistent fatigue. This next sign is so common that most people blame everything except their kidneys. Crushing, overwhelming fatigue that doesn't improve with rest. We're not talking about being tired after a long day. This is waking up exhausted after 10 hours of sleep. Here's the science. Healthy kidneys produce a hormone called erythropoietin, EPO, that tells your bone marrow to make red blood cells. When kidneys fail, EPO production drops, leading to anemia. Fewer red blood cells means less oxygen reaching your brain and muscles. Patient testimony style: I thought I was just getting older, one patient told me. I needed naps at lunch, couldn't climb stairs without stopping, and even thinking felt exhausting. My doctor kept saying I was just stressed until blood work revealed stage 4 kidney disease. The fatigue from kidney disease has a unique quality. It doesn't improve with coffee or energy drinks. Sleep doesn't refresh you. Simple tasks feel monumentally difficult. You might feel cold all the time, even in warm rooms. Sign number 4, skin changes. Your skin is your body's largest organ, and it's often the first to show when something's wrong internally. With kidney disease, you might notice extreme itching, pruritus. When kidneys can't filter waste products like urea and phosphorus, they build up in your blood and deposit in your skin. This isn't ordinary itching. Patients describe it as feeling like insects crawling under their skin, especially at night. No amount of scratching brings relief, and anti-itch creams barely help. Color changes. Your skin might become pale or grayish due to anemia, yellowish-brown from waste product buildup, darker in creases and folds. Dry, flaky skin. Kidneys help maintain the right balance of minerals. When this balance is disrupted, your skin loses moisture and becomes rough, scaly, and may even crack and bleed. Warning: if you're experiencing severe itching with no visible rash, especially if it's worse at night and accompanied by other symptoms on this list, see your doctor immediately. Sign number 5. Metallic taste and bad breath. Imagine everything you eat tasting like you're sucking on pennies. That metallic taste in your mouth, medically called dysgeusia, happens when waste products build up in your blood, a condition called uremia. But it gets worse. This buildup also causes ammonia breath. Others might notice your breath smells like urine or ammonia, loss of appetite. Food becomes repulsive, nausea after eating, especially protein-rich foods, weight loss, not the good kind. Personal anecdote style. One patient described it perfectly. My morning coffee tasted like metal. Meat made me gag. My wife said my breath smelled chemical, even right after brushing. I lost 20 pounds in 2 months, and everyone congratulated me on my weight loss. Little did they know my kidneys were failing. This isn't just unpleasant, it's your body literally becoming toxic from the inside out. The waste products that should be filtered out are poisoning your system. Sign number 6. High blood pressure. Here's a vicious cycle most people don't understand. Kidney disease causes high blood pressure, and high blood pressure causes kidney disease. It's a deadly spiral that accelerates damage to both your kidneys and your entire cardiovascular system. Your kidneys regulate blood pressure by controlling fluid volume in your body, producing hormones that narrow or widen blood vessels, managing sodium levels. When they are damaged, blood pressure skyrockets. But here's the scary part. High blood pressure is called the silent killer for a reason. You might feel perfectly fine while your blood pressure is destroying your organs. Critical numbers. Normal, less than 120/80, elevated, 120/129/80, high, 130/80 or higher. If your blood pressure is consistently above 140/90, especially if you're young or it's resistant to medication, your kidneys need immediate evaluation. Sign number 7. Foamy urine, the morning warning. Remember I mentioned a sign you see every morning? This is it. Foamy urine, not just a few bubbles that disappear quickly, but persistent foam that looks like someone poured beer or cappuccino foam into your toilet. Demonstration description: normal urine might have a few bubbles that pop within seconds. But protein-laden urine creates stable foam that can last 5, 10, even 15 minutes. Some patients describe it as looking like beaten egg white sea foam on a beach, the head on a freshly poured beer. This happens because protein, especially albumin, acts like soap, creating stable bubbles. Healthy kidneys keep protein in your blood where it belongs. Damaged kidneys let it leak through. Critical distinction, however: don't panic if you occasionally see foam. Dehydration, rapid urination, or even toilet bowl cleaners can cause temporary foaming. The key is persistence. If you see foam day after day, especially with other symptoms, that's a red flag. Sign number 8. Muscle cramps. Sudden, severe muscle cramps, especially in your legs at night, might seem unrelated to your kidneys. But when kidneys fail to maintain proper electrolyte balance, your muscles pay the price. Kidneys regulate calcium, for muscle contraction, potassium, for muscle relaxation, magnesium, for nerve function, sodium, for electrical signals. When these get out of balance, you might experience painful leg cramps that wake you from sleep, muscle twitching you can't control, weakness in your arms and legs, restless leg syndrome. Patient story: the cramps were unbearable. I'd jump out of bed screaming, my calf muscle locked in a painful knot. My husband had to massage it for minutes before it would release. We tried everything: bananas for potassium, magnesium supplements, more water. Nothing helped until we discovered my kidneys were only functioning at 40%. Sign number 9. Shortness of breath. Can't catch your breath after climbing stairs? Feeling winded just walking to your car? This could be your kidneys screaming for help. There are two main reasons kidney disease causes breathing problems. Fluid in the lungs. When kidneys can't remove excess fluid, it can accumulate in your lungs, pulmonary edema, making breathing feel like you're trying to breathe through a wet towel. Anemia. Remember that hormone EPO we discussed? Without enough red blood cells to carry oxygen, your body constantly feels oxygen-starved, even when you're just sitting still. Warning signs. Breathlessness when lying flat, you need multiple pillows to sleep, waking up gasping for air, feeling like you're drowning or suffocating, rapid, shallow breathing even at rest. This isn't just uncomfortable, fluid in the lungs is a medical emergency that can be fatal if untreated. Sign number 10. Persistent nausea and vomiting. When waste products build up in your blood, uremia, your body desperately tries to get rid of them any way it can, including making you vomit. This isn't ordinary nausea from a stomach bug. It's worse in the morning, triggered by the smell or thought of food, accompanied by a complete loss of appetite, persistent for weeks or months, not relieved by anti-nausea medications. Medical explanation: your body is literally trying to expel toxins. Some patients describe feeling poisoned from the inside out. They might go days eating only crackers and water, losing dangerous amounts of weight. The combination of nausea, vomiting, and loss of appetite creates a dangerous cycle. You can't eat, so you become malnourished, which further weakens your body's ability to cope with kidney disease. Sign number 11. Difficulty concentrating. Brain fog isn't just a trendy term, it's a real and frightening symptom of kidney disease. When toxins accumulate in your blood, they affect your brain function. Patients describe feeling like they're thinking through molasses, forgetting common words mid-sentence, unable to focus on simple tasks, making dangerous mistakes, wrong medication doses, forgetting to turn off the stove, personality changes, irritability, depression, anxiety. Case study: a 45-year-old accountant came to the emergency room after making serious errors at work. He couldn't remember his children's names. His wife thought he was having a stroke. Blood tests revealed severe kidney failure. His blood was so toxic it was affecting his brain function. This cognitive impairment can be partially reversed with treatment, but the longer it goes untreated, the more permanent damage may occur. Sign number 12. Persistent back or side pain. Not all back pain is from poor posture or lifting something heavy. Kidney pain has distinct characteristics. Location: just below your rib cage, on one or both sides of your spine. Place your hands on your hips with thumbs pointing toward your back. Your kidneys are right under your thumbs. Quality: dull, persistent ache that doesn't change with movement, may radiate to your lower abdomen or groin, doesn't improve with rest, or position changes, may be accompanied by fever if there's infection. Important distinction: kidney stones cause severe, wave-like pain. But chronic kidney disease typically causes a constant, dull ache. Some patients describe it as feeling like someone is pressing their fist into their back. Sign number 13. Unexplained weight loss or gain. Your weight might fluctuate dramatically with kidney disease, and both scenarios are dangerous. Weight loss. Loss of appetite from nausea and metallic taste, protein wasting as kidneys fail to recycle proteins, muscle mass deteriorating, vomiting, and inability to keep food down. Weight gain. Rapid gains of 2 to 5 pounds in a day or two. This is fluid retention, not fat. Clothes and shoes suddenly don't fit, face looks puffy and bloated. Tracking tip: weigh yourself at the same time daily. A gain of more than 2 pounds in a day or 5 pounds in a week, especially with swelling, is a medical emergency warning sign. Sign number 14. Sleep problems. Kidney disease disrupts sleep in multiple ways. Sleep apnea. Toxin buildup affects breathing control centers in your brain. You might stop breathing dozens of times per night. Restless leg syndrome. An overwhelming urge to move your legs, especially at night. It feels like insects crawling under your skin. Frequent urination. Waking up 3 to 5 times to urinate destroys sleep quality. Muscle cramps. Painful cramps jolt you awake. Itching. Severe itching is often worst at night. Poor sleep creates a vicious cycle. It raises blood pressure, worsens kidney function, and impairs your body's ability to heal. Sign number 15. The emergency room sign, seizures or confusion. This is the sign that sends people to the emergency room, but it should never get this far. When kidney failure becomes severe, toxins can cause seizures, extreme confusion, or delirium, hallucinations, coma. This is called uremic encephalopathy. Your brain is literally being poisoned by waste products. At this point, emergency dialysis is often the only option to save someone's life. Sobering statistics: by the time someone reaches this point, they've likely had kidney disease for years. The tragedy? It was preventable. Every single sign we've discussed today appears long before this crisis point. If you've recognized even 2 to 3 of these signs, here's what you need to do today. See your doctor immediately and request complete blood count, CBC, comprehensive metabolic panel urinalysis GFR, kidney function test, urine albumin test. Document your symptoms, keep a diary of what you're experiencing, know your risk factors: diabetes, leading cause, high blood pressure, family history, age over 60, obesity, smoking. Remember Sarah, the marathon runner I mentioned? She caught her kidney disease in time. With medication and lifestyle changes, she stabilized her kidney function and avoided dialysis. Your kidneys are silently working 24/7 to keep you alive. The least we can do is listen when they are crying for help. Share this video with someone you love. You might just save their life. And remember, early detection can mean the difference between managing kidney disease with medication and spending the rest of your life on dialysis. Don't wait until sign number 15. Act now. If this video helped you, please hit the like button and subscribe for more life-saving health information. Comment below if you've experienced any of these signs. Your story might help someone else recognize their symptoms in time. Stay healthy, stay informed, and most importantly, listen to your body. It's always trying to tell you something.